Hello, this is our project on what are prosthetics and how do they relate to biomechanics. Our names are Laura Ambrose, Beta Ragu, and Minody Thakur. Prosthetics involve the custom fitting of artificial limbs and can enhance the lifestyle of many people with amputations. Amputations result from trauma, medical illness, or surgery. Below show the four main types of artificial limbs, starting from the left is the transtibial prosthesis, which replaces a leg missing below the knee. Next is the transfemoral prosthesis, which replaces a leg missing above the knee. Next is the transhumeral prosthesis, which replaces an arm missing above the elbow. Lastly, to the right is the transradial prosthesis, which replaces an arm missing below the elbow. In our project, we are going to focus on the biomechanics behind transtibial prosthesis. This prosthesis consists of a socket that is custom-made, as you can see in the leftmost diagram, a linear pylon connecting this socket to the foot. When designing the socket of prostheses, prosthetists optimize biomechanics to aid the amputee. They do this by first marking bony and soft tissue areas on the skin. The prosthetist then uses Paris plaster to start the casting procedure. The prosthetist mimics what would happen within the socket of the prosthesis. This includes applying pressure at pressure-tolerant areas, as well as defining pressure-sensitive areas. This is to relieve the most pressure for a specific amputee for comfort. To the right is a brief video showing this procedure.
When dunking it in water, it will actually set off a chemical reaction that will harden the material after about 5 minutes. So during this time, you've got about a 3 to 5 minute working time where the practitioner will apply it to the limb in very specific ways and start to apply pressure to it in very specific ways as well. In this case, the practitioner has taken an entire roll of plaster and is wrapping it circumferentially all the way around the limb to create a nice thin layer.
Transtibial prosthetics are placed below the knee, and a majority of individuals who get transtibial prosthetics are able to regain normal movement. This is largely due to the fact that the knee joint is still present in this type of prosthesis. New technology allows many patients to physically feel the prosthetic move, as physiotherapists can now connect the prosthetic leg to a patient's central nervous system. This video clip is an example of normal movement being regained after a transtibial prosthesis. The prosthetic needs to be fit correctly in order to withstand high internal loads. There are three types of internal loads in 2D cases: normal forces, shear forces, and bending moments. Normal forces act perpendicular to the surface, as shown by the green arrow. Shear forces are along the surface, as shown by the red arrow. And the bending moment is the torque applied to both sides of the prosthetic as if they were cut in two, as shown by the curved dark green arrow. The net or total loads have to be equal to 0 in order to achieve equilibrium. If they do not equal 0, then the prosthetic will break.
The distribution of forces are important in prosthetics because a prosthetic device changes how forces interact with the body by applying force over a certain area. When a force is applied to the human body, it is done so over an area of skin which produces pressure. Pressure is equal to force over area, and this equation shows that pressure and area are inversely related. And when a force is distributed over a larger area, pressure is reduced, as shown in the picture. When the force is distributed over a larger area at the bottom of the foot, the pressure decreases proportionally. While designing prosthetic sockets, the goal is to spread force over a large enough area to reduce pressure and decrease pain or chance for injury. One role of lower limb prosthetics is to provide axial loading, which is the force produced when body weight pushes on the ground. If a prosthetist deems that an area is ideal for axial loading, then a large amount of force can be transmitted through it. And the forces are usually provided parallel to the skin, which reduces shear force, and the prosthetic device must be made strong enough to hold this weight. The ground reaction force also causes a moment around the prosthetic socket and the residual limb of the amputee, which results in pressure inside the socket. The pressure points are labeled in the diagram, and it is important to distribute the forces across a large area to reduce this pressure.
When developing transtibial prosthesis, it is important to take note of the ground reaction force. Following Newton's third law, the ground reaction force is the equal and opposing force passing through the foot of the prosthesis and the ground surface. This force is due to body mass, which also includes the momentum and accelerations of the specific body we are measuring. As you can see in the diagram of the transtibial prosthesis to the right, the ground reaction force changes when walking. When the heel of the prosthesis is the only contact area on the ground during walking, the ground reaction force is less perpendicular, focusing its force toward the center of mass. Due to respecting these ground reaction forces, prostheses are able to be made individually for patients by manipulating the position of the limb as well as prosthetic joints. As you can see in the center of mass distribution figure to the right, the center of mass is represented by the red circle. In the able-bodied person on the left, the center of mass is aligned in the center of the body. The ground reaction forces of this person are balanced by an internal force. However, the amputee on the right shows a missing left limb, therefore moving the center of mass slightly up and to the right. When forces do not act directly on the center of mass of an object, it will cause it to rotate. When designing prosthesis, it is important to balance the moments caused by this ground reaction force, or it may change the angle of the joints. This change of angle is important to limit where it may have a negative impact on the success of the prosthesis.
In this image, the force of the ground on the prosthetic is acting as equally as the force of the prosthetic on the ground. This is shown by the lime green and cyan arrows. There are many forces acting on the prosthesis, and the mass moment of inertia is incredibly important in manipulating the prosthetic. The mass moment is essentially the amount of force necessary to move an object about a rotational axis. This is really important to know because when the prosthetic is in use, the movement of the leg is angular, as the leg has rotational motion. This is shown by the purple arrow. It can help physiotherapists with creating a prosthetic that has just enough resistance, so the prosthetic doesn't move too loosely, nor is it too stiff.
Overall, prosthetics serve as an artificial device that replaces a missing body part and can enhance the lifestyle of someone with a missing limb. People who use prosthetics must get used to these devices because the distribution of forces is different and they do not have control over certain joints. The picture shows the different types of movement that someone with prosthetic limbs must get used to. In normal movement, people are able to feel what their limbs are doing. However, a person who has a prosthetic limb cannot feel its movement and lack direct control. The biggest adjustment for people with artificial limbs is around the joint or prosthetic socket and residual limb because this is where most of the pressure occurs. The body must adjust to taking pressure in through a different surface of the body when standing or walking. For example, the back of the lower leg instead of the sole of the foot for a below-knee amputee. The forces must be distributed or readjusted to avoid high amounts of pressure on the joint areas. This demonstrates the importance of biomechanics in prosthetics to understand how pressure problems occur and can be fixed. Biomechanics is needed in prosthetic development since it influences many aspects of prosthetic rehabilitation. Thank you.